Hello and welcome to the Lymphedema Association of Manitoba's annual Lymphedema Awareness Day Symposium. Today's primary topic is identifying and treating lymphedema-related fibrosis. My name is Adrienne Pearson, and I'm your main event host and the president of LAM, or the Lymphedema Association Manitoba. I work as a skin and wound consultant in Winnipeg, Manitoba, and I began my journey as a certified lymphedema therapist from attending a Lymphedema Awareness Day event just like this. In 2019, it was called the Big Breakfast. I see patients that are undiagnosed and often untreated with lymphedema all too often in the hospital setting. This is a major reason I became involved with LAM. I'm most passionate about educating others about lymphedema and its best treatment. So you'll notice today at this event that it's being recorded and your microphone is muted. I invite you to look in the Zoom chat where you'll find Kim Radford, one of our board members, who's greeting you there. And as well, you'll find a link to today's itinerary for this symposium. If you have questions for our guest speakers, please type them into the chat. Any unanswered questions, we will contact the individual afterwards by email, or we can post answers to questions in an upcoming newsletter. We have some exciting prizes at the end, and we will go over these at the close of the symposium. So what is LAM? The Lymphedema Association Manitoba is a patient-focused nonprofit organization founded in 2011 by Kim Avonte, who struggled to find a diagnosis for her sick child born with primary lymphedema. LAM pursues resources, information, education and awareness and support for those affected or at risk for primary or secondary lymphedema, their families, healthcare professionals, and the general public. We're entirely 100% volunteer run. Its volunteers are a combination of those with lymphedema, family, friends of those who have been impacted by lymphedema, and health professionals who see lymphedema or treat lymphedema. So I'd like to introduce our hardworking board of volunteers. Amanda Sobey is our vice president and professional advisory. She's waving. We have Kim Radford, treasurer and secretary, and A. Seho, communications, Ron Wersch, membership, Bonnie Ash, membership, and Jessica and Diamond and Isabel Thorbertson, fundraising and public relations. So I'd like to introduce you all to Amanda Sobey. As I mentioned, she's LAM's vice president, and she has a diagnosis of secondary lymphedema. Professionally, Amanda is a certified personal trainer, a certified nutritionist, and a lymphy coach. Amanda is very passionate about creating awareness for lymphedema, and she's going to provide us with a description of lymphedema right now. Welcome, Amanda. I think you're muted, Amanda.
Always. It's great to see everybody. Thank you so much for the introduction. It's a bit fumbling around over here just because it's my first meeting with you all and I'm trying to get organized. But the brief introduction for lymphedema, for those of you who may not know, is that the lymphatic system is kind of like the plumbing system for the human body. It is responsible for all the waste that your cells make. And unfortunately, this disease is very under-recognized, which is obviously the major reason for advocacy and awareness. And there's two types of lymphedema. So one is known as primary lymphedema. The second is known as secondary lymphedema. Primary, you guys have me all nervous. I don't know why. Primary lymphedema is for those that are born with it. It's congenital. It can be present at birth, during puberty, or in the mid-30s, and it predominantly shows up in females more so than males. However, that's not exclusive. Secondary lymphedema is an occurrence due to trauma, also known parasite known as filariasis can cause it. Cancer, obviously having radiation and chemotherapy and lymph node removal would be another cause for secondary lymphedema. And those are the two different forms. And what I've realized and recognized, and I'm sure a lot of people agree with me, is that it's not necessarily how you get the condition, but it really matters on what you do because of it. And I'm hoping that with today's webinar and our advocacy efforts, we really get to educate people to take back their health, encourage them that there is a lot that they can do if they know what to do, and just, of course, surrounding yourself with a knowledgeable team and knowledgeable experts that will help further support your condition.
Thanks, Amanda. So just to go through some of the stages of lymphedema. So as Amanda mentioned, it's a lifelong condition that will worsen if untreated and unmanaged. So there are 4 stages of lymphedema. So stage 0 is an early stage. There might be no visible signs of swelling. The limb may feel heavier, maybe some subtle tissue changes. And then stage 1 is where you have mild lymphedema. So the swelling at this point could be reversible. One may show signs of a bit of pitting. So for example, where a finger is pressed, it might leave an indent. The swelling often improves when the leg or arm is raised, for example. And then stage 2 lymphedema is moderate. So the swelling cannot be reversed at this point. So for example, raising the affected limb no longer helps reduce swelling in the tissues, and tissue fibrosis or hardening may be seen and felt. So stage 3 is advanced lymphedema, where swelling becomes severe. The skin becomes very hard and fibrotic. It may not even indent at this point with some finger pressure, and the skin may be dry and thick and maybe even have growths, wart-like growths or leakage of fluid called lymphuria. So the gold standard of treatment for lymphedema is termed complete decongestive therapy. So it consists of manual lymphatic drainage, MLD, compression therapy, skin care, and appropriate exercises. Patient instruction and self-care is an important component as well. And manual lymphatic drainage is a special type of gentle massage that promotes lymphatic flow and helps with relaxation, pain, and improves the ability for someone to move. So really important here is a team of qualified doctors and therapists that are invaluable to provide assessment, diagnosis, treatment, and information. So these supportive networks are so important for the impacts of lymphedema, because we know that it really impacts individuals physically, emotionally, psychologically, and financially, of course, as well. So I'd like you to join me later on when we introduce Amanda again for an interactive break, where she'll show us the benefits of exercise, movement, deep breathing, and how that benefits lymph flow. So the Canadian Lymphedema Framework is someone who states that there are probably over 1 million Canadians suffering with lymphedema and or chronic edema, and this can affect all areas of the body, but primarily the limbs is what's seen. And most of these Canadians can often be undiagnosed or untreated. So March 6th is tomorrow, and it's World Lymphedema Awareness Day. It's a day to come together to create support, awareness, educate, and advocate for better treatment and funding and resource for this incurable disease. And to celebrate also how far we've come and how far we're coming, especially with a lot of recent advances in research. Speaking of lymphedema awareness, I would like to now invite the Honorable Wayne Owasco, who's the MLA for Lac du Bonnet. Wayne has been instrumental in advancing Bill 209, the Lymphedema Awareness Day Act, and this was enacted into the Manitoba legislation in June 2014. So I want to thank Wayne for his years of support and all he does to advocate for increased awareness for lymphedema in Manitoba. Welcome, Wayne.
Thank you, Adrienne, and hopefully everybody can hear me okay on this virtual Saturday. So of course, I'm absolutely more than honored to bring greetings today on behalf of Premier Stephenson and the Honorable Audrey Gordon, Minister of Health, and especially in recognition of tomorrow's not only World Lymphedema Awareness Day, but of course, Manitoba, right here in the great province of Manitoba, Lymphedema Awareness Day tomorrow, which is March 6th. I'd also like to acknowledge that we here in Manitoba reside on treaties 1, 2, 3, 4, and 5 lands, which are the traditional territories of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and of course the homeland of the Métis Nation. I'd like to first of all thank you, Adrienne, and of course Lam, along with the board, and today's guest speaker, Karen Ashforth, who will be providing insight and information on identifying and treating lymphedema-related fibrosis. I would like to commend the dedication of LAM President, again, Adrienne, and past President Linda Menzies, and absolutely everybody who I've had more than a great pleasure to get to either know or work with over the last it's about 11 years now. It's actually amazing. As many of you are aware, and Adrian already mentioned that in 2014, I introduced Bill 209 as the MLA to proclaim March 6th every year as Lymphedema Awareness Day in Manitoba. And earlier this week, just on Thursday, I made a statement in the Manitoba legislature about Lymphedema Awareness Day in Manitoba, alongside my my colleague, the Minister of Health, Audrey Gordon, did a ministerial statement and basically trying to raise the importance of public awareness of this condition and disease, incurable disease, to honor all Manitobans who suffer from the disease, as well as celebrate the progress made by Lymphedema Association of Manitoba. I know that in the past that we have had the president and the board come in to speak with our PC caucus, and I've already sort of before the meeting started, I've already put out that invite to Adrian, and we will coordinate to get her and the board in to have a discussion. And I'd just like to say, send my sincere hopes that you're going to have a great symposium again this afternoon. Have a great walk tomorrow. Unfortunately, I'm not joining you tomorrow for the walk because I've got a conflict with the Canadian Power Toboggan Championships, which are held in Beausejour. So which I'm also attending. So thank you all very much. Again, it's very important to bring awareness, because I think that's exactly where we need to continue on this journey, as especially we know that within Manitoba, we've got about over 38,000 that are diagnosed, but there's many, many more. We all know that there's many, many more that are suffering from this disease. They just haven't been diagnosed yet. And it comes down to education, and then having that education carry over to also, our doctors and our specialists, so that the doctors and specialists can then basically help with the diagnosis. I know that many people are sort of labeled with obesity, but definitely, once some more education gets out there, not only to the individuals themselves that are suffering, but to the doctors, I think more and more people are, and again, due to the great work of LAM and World Lymphedema Day, and of course, Manitoba Awareness Day here in Manitoba, I think it definitely helps to bring the awareness and the disease to the forefront. So again, thank you very much. Have a great symposium today. Have a safe walk tomorrow. It looks like it's going to be some decent weather. And again, thank you very much for the invite, Adrian, and we'll talk to everybody soon.
Thank you so much, Wayne. Appreciate you being here and for your support. So I'm now proud to also introduce someone else to you, another strong advocate for lymphedema, and one of LAM's founding members, Kim Avonte. So I want to thank Kim for coming, and I want to ask her to share with us today a little bit about how LAM got started and where it's brought her today. So thank you, Kim Avonte, for being here.
Hello, good afternoon, everyone. Thank you, Adrian, for the introduction and inviting me to bring greetings for the LAM's World Lymphedema Day event. I'm excited that LAM is not only acknowledging Lymphedema Awareness Day, but is also celebrating their 10th year in the making. With this, I think it's fitting to reflect on where it all began.
Oh.
No diagnosis, no information. No support. Turned into panic, helplessness, fear, and anger. And that turned into action and the Lymphedema Association of Manitoba. This grassroots organization was created to give lymphedema a voice in Manitoba and to let those suffering know they are not alone. I am thankful to all the LAM supporters and board members, past, present, and future, that their efforts continue to make positive strides in awareness and support for lymphedema. A big challenge in the past, and I'm sure is still a struggle today, is to find new members. those that need the lamb and may not even know the lamb exists. It goes without saying that another hurdle is to gain acknowledgement and support from provincial health. Lymphedema treatment needs to be recognized and financially funded. Providing early diagnosis and treatment and assistance to achieve maintenance and management will go a long way and lessen the burden on the healthcare system. That would be a great achievement, to have all Manitobans aware of lymphedema and having the support readily available to provide those suffering the tools they need for a better quality of life. As a past board member of the Canadian Lymphedema Framework, it is also important to know that they too are working diligently to provide consistent information and support at a national level. It is these relationships, along with the other provincial associations, that will continue to grow lymphedema awareness across the country. Congratulations, LAM, on your 10th anniversary. I look forward to watching your continued growth and success, raising lymphedema awareness and support in Manitoba. I challenge all to be a lymphedema advocate, spread the word, and help raise awareness. With sincere gratitude, I thank you.
Thank you very much, Kim. That was very well said. And really good to have that visual as well of your son and where this all started. So thank you very much for being here. And it's an honor to carry forth the work that you began at LAM. So now it brings me great pleasure to introduce our symposium guest speaker for today, Karen Ashforth. Karen is speaking on identifying and treating lymphedema-related fibrosis. Karen has been an occupational therapist for 40 years. She has a Master of Science and is a LANA certified lymphedema therapist. Karen's greatest passion in clinical practice is addressing underlying autonomic, fibrotic, and inflammatory factors to promote greater health. She currently works treating lymphedema and lipedema patients at a hospital-based outpatient clinic. She has a private practice providing inpatient and telehealth consultation and is an adjunct faculty member with the University of the Pacific in the doctoral physical therapy program. Karen speaks frequently at academic, clinical, and professional settings and performs IRB-sanctioned clinical research that she presents and publishes nationally and internationally. Karen's full bio is available on LAM's website on the events page, and I will now welcome Karen to join us.
Thank you so very much. It's such an honor to speak to all of you. And I want to just say before I start my talk that with so much uncertainty in the world right now, it feels good to come together in the name of healing. My deepest mission in life is to promote healing, and the topic of fibrosis in lymphedema and lipedema is such a rich area to make a difference. I'm so happy that you've all joined me for this talk, and I hope that this information will be helpful. I just put in the chat that I'm very delighted that this is being recorded and that the recording will be available on the LAM's YouTube channel. And I also want to make my slides available, but it won't be for a few weeks because I'm going on holiday starting tomorrow. I'm taking a road trip to Arizona and Nevada. But after I return, I would like to post my slides on my website, and I've given a link to that. So if there's something that I've said that you want to look up an article or more resources, I want you to have that resource. So when I'm treating my patients, my goal is to give them tools and education that allows them to have more control over their symptoms and their lives. If we can possibly manage swelling, decrease pain, increase function, and even put lymphedema in remission, by healing fibrotic tissues and increasing spontaneous lymphatic circulation, that's what we strive for. Frankly, I could talk for a week about fibrosis and all the very specialized ways to get the better of it. So today is just an introduction to the topic, but I hope that through this talk, I can inspire interest and awareness and of how much hope there can be by learning more about fibrosis and how to treat it. So I'm now going to share my screen. What we're going to accomplish today with a lot of information is really due to the help of our sponsors. And I want to acknowledge Diamond Athletic Medical Supplies, Essity, Juzo, Eleanor, and Sigvaris for their support in making this talk possible. Later on in the talk, when I talk about treatment, I'm going to be mentioning some different types of compression garments that are manufactured and available through these suppliers. So here's what we're going to start with. I have no disclosures or conflicts of interest for this talk. I'll be first explaining about what fibrosis is and what causes it. Then we're going to look at the different types of fibrosis that can commonly occur with lymphedema and lipedema. We'll look at how we can identify fibrosis, and then the relationship between inflammation and fibrosis. We'll do an overview of the different types of treatment, and my focus today will be on inflammation and compression in terms of treatment. So, all people with lymphedema have fibrosis to a varying degree. Fibrosis is when tissues become damaged. They can either be hard, thick, and dense, or they can be soft and fatty. But in either case, the healthy tissues are replaced by scars, radiated tissue that forms a hard collagen matrix, or soft fatty tissue, which is characteristic of lymphostatic fibrosis. As Adrienne mentioned, there are 4 stages to lymphedema. And what I did, digging a little bit deeper into these definitions, is that lymphedema is staged by fibrosis. So in stage 0, or the latency stage, where we can't palpate or see swelling, there are already fibrosclerotic changes occurring. In stage 1, there may be some swelling that's pitting and reversible with elevation, but the fibrotic changes are continuing to progress. And then by stage 2, where there's more extensive fibrosclerosis and adipose deposits, the swelling cannot be fully reduced. So someone may have a swollen arm or leg, and it can be partly reduced, but not fully, because the fibrosis is now adding extra tissue. By stage 3, the damage is so profound, it is so extensive. There's usually skin changes and massive fibrotic deposits that can cause a lot of deformity and affect function. So I'm a visual person, and I would like to show you some pictures from my patients. By the way, everyone has signed a release to allow me to use their pictures for presentation. And you can see from stage 0 progressing on to stage 3 that there is greater volume, and in stages 2 and 3, the fatty, bulky fibrosis that has swelling inside of it that can be partly reduced, but never fully. And with the legs, we can see the same thing. There's also stages of lipedema. And I use the 3-stage system for lipedema. I know that some people have defined 4 stages, with stage 4 being the mixed lymphedema with lipedema. And in my practice, and the more that I've read, I see that swelling can occur in any stage of lipedema. So let's talk about fibrosis. This is one of my patients who had breast cancer, and you can see several types of fibrosis in this picture. She's beginning to develop lymphostatic fibrosis. You can clearly see her scar, which is becoming quite keloid. You can see the hyperpigmentation from the radiation, and she's developing radiation-induced fibrosis, which is also impacting her scar. And in addition to these types, we're going to talk about a few other types that are very commonly seen in upper body. With the legs, in this picture, you can see that this patient is developing lymphostatic fibrosis. She clearly has Lipodermatosclerosis, which is a common presentation with patients that have chronic venous insufficiency. There is extensive dermal fibrosis, and you can also even see signs of post-cellulitis fibrosis. So the point of these pictures is to say that patients can have combinations of fibrosis. And so it's good to know what each one is so that they can be addressed. With lipedema, we see subcutaneous adipose tissue fibrosis, which is a very specialized type, as well as nodular fibrosis. So we're going to begin by talking about lymphostatic fibrosis. And we have a picture on the left of a stage 3 foot, which is profoundly affected by swelling and fibrosis, and a stage 2 arm on the right. Lymphostatic fibrosis is present in all stages and all types of lymphedema. As we mentioned, stage 2 and 3 are irreversible because of this fibrosis. It is formed through an inflammatory process. With lymphostasis, there's a high protein extracellular matrix which attracts fat cells and over time forms a fatty matrix. It becomes permanent fatty tissue that will not fully reduce. And it becomes a vicious cycle because the lymphatics are damaged. There's an increase in swelling, which then creates more damage. I want to acknowledge Dr. Håkan Brorsson for sharing this slide with me. And he has been a pioneer in the area of liposuction treatment for lymphedema. And what he found that I find so fascinating is that when he did liposuction with his patients, he found an average of 90 to 100% of adipose tissue in the aspirate. So you can see the difference between the first and the second picture. And that tissue is fatty tissue with swelling hidden inside. Next, we're going to move on and talk about scar fibrosis that can occur either from surgery or from trauma. When we have wound healing, the purpose of the scar is to rapidly restore the outer barrier of the body to prevent further injury and form a barrier to prevent infection. However, when gone awry, it can create a barricade to lymphatic function. And current research is examining the way to inhibit fibroblast activity to produce decreased scarring. Radiation-induced fibrosis can occur anywhere, and it can be very, very difficult. It can create collateral damage in many ways. It can damage large areas. The tissues become thinner, harder, and more brittle in composition. It compounds the damage to surgical scarring and makes them harder and denser. It can affect the skin, organs, nerves, blood vessels, and muscles, and it affects many parts of the body all at once at different depths. It can also progress for years, and so many people will call it the gift that keeps on giving. This is an example of cording. You can see the cords in the armpit, which we see sometimes in breast cancer related. And it's also called axillary web syndrome, where these visible cords of tissue usually run between the axilla and the cubital fossa of the elbow. They can also occur on the trunk, the entire arm, and stretch all the way down to the hand. These cords can be painful, and they can restrict arm movement and function. And up to 72% of cords occur within 4 weeks of surgery. This little lump that looks a little bit like a pacemaker is actually a seroma. And a seroma is also called a lymphocele, and it's a common complication after mastectomy surgery or lipectomies also. It's a dead space that is herniated with a pocket of fluid, and the persistent swelling turns into a fibrotic mass. And I have seen seromas turn into objects that are as hard as golf balls. It increases the risk of infection. There can frequently be pain, and it can affect the range of motion. This is an example of fat necrosis. It's a common complication after breast reconstruction where there is death of adipose tissue that produces scarring, calcification, and it can be quite distressing because it can mimic breast cancer reoccurrence. The top risk factors for fat necrosis are diabetes, obesity, radiation, and smoking. And I have seen these create a lot of pain. They can also contribute to breast atrophy as well as contracture. You can see the discoloration here on the left leg and under the armpit. And this is where there's been a cellulitis infection. You can see it's a lighter color. And I was shocked to find out the statistics, but people with lymphedema have 71 times the risk of an infection compared to people without lymphedema. The risk is increased with the advanced stages of lymphedema, and that's because fibrosis can restrict lymphatic circulation. Each episode of an infection can increase fibrotic damage as a result of cell death during the infectious process. And the infectious waste forms a dense mask around the infection site, and that resulting fibrosis can continue to impair circulation and lead to repeat infections. This is a patient of mine that had a blood clot in her left thigh, and she ended up with very severe swelling and fibrosis. I have happy news that she was able to reduce beautifully, and we worked a lot on her fibrosis. So post-thrombotic syndrome is the most common complication of a deep vein thrombosis. And with early treatment of the embolism, it lowers the risk of fibrosis formation. The actual vein wall can be irreversibly fibrosed and can create a mechanical obstruction even once the deep vein thrombosis is resolved. This is a picture of a patient that has Lipodermatosclerosis, and this is a very characteristic picture. It's a scar-like fibrotic band that forms around both ankles. And then you can see that the calves were very, very swollen. Sometimes the feet are swollen as well, sometimes not. And this is very common in chronic venous insufficiency. It is characterized by the small ankles and large calves. And it's sometimes called an inverted champagne bottle or an inverted bowling pin. As Adrienne mentioned, skin changes are certainly possible with the later stages of lymphedema in late stage 2 and stage 3 most commonly. And here you can see a variety of dermal fibrosis that has happened with many of my patients. It can include hyperkeratosis, papillomas, lichen, atrophy blanche, and stasis dermatitis. This occurs as a result of poor lymph circulation, and increasing circulation can be very helpful, as well as skin care and debridement techniques. Patients with chronic wounds can develop a fibrosis around the wound bed. So the border of tissue surrounding the wound can become quite hard, and that creates a vicious cycle that contributes to poor wound healing. So it's very critical to increase the circulation and decongest the area in a way that helps to facilitate wound healing. With wound bed fibrosis, that sustained excessive inflammation creates a suboptimal environment for wound healing and fibrosis development. And this fibrotic plaque around the wound creates a mechanical blockage that contributes to decreased vascularization, poor nutrition, and slow healing. Here's an example of massive localized lymphedema, which tends to occur in late stage 2 and stage 3 of lymphedema. And in this case, we have very massive, hard tissues that have stiff, thick skin. It's often called a pseudosarcoma, and it often occurs with obesity. It's usually on one side, but I've seen it on both sides. And usually it's on the upper thigh, often the arm, but also can occur as an abdominal pannus in the suprapubic area, the scrotum, and at the knee in the popliteal fossa. So we're going to switch gears and talk a little bit about lipedema-related fibrosis. And the most common type, which is common to all lipedema patients, is the inflamed SAT or subcutaneous adipose tissue. This is a type of fibrosis that is unique to lipedema. It is actually diseased fat tissue that turns into a progressive fatty fibrosis, which is similar to the lymphostatic fibrosis, but has unique characteristics to lipedema because it is influenced by estrogen and weight gain, as well as inflammation, leaky and dilated vascular and lymphatics. It's often accompanied by pain and easy bruising. And this subcutaneous adipose tissue blocks circulation. It increases swelling and can create nerve compression, which can create pain. Another type of fibrosis we see with lipedema, not every patient, is a lipedema nodular fibrosis. These nodules, they range in size from a grain of rice to walnut size or even larger. And they're created by the inflammatory process of lipedema, in which a hard fibrosis forms around the clumps of subcutaneous adipose tissue, and it is very, very painful. All right, we're going to switch gears again and talk about how to assess fibrosis. How do you know what it is? What are the qualities of it? What can you change about it? So first and foremost is by palpation and observation. We use our hands, we use our eyes, we determine where it is and how big it is. And I encourage people to remember to address the back because often that's a place that's forgotten. We try to get a sense of how deep it is. Is it just superficial? Scars can go much deeper than the superficial openings. So does it cover a regional area, as with radiation-induced fibrosis? We want to determine the scar stage. Is it granulated and immature, or is it well-healed and even keloid? We also want to take a look at the skin, at the health of the skin, the integrity, how elastic the skin is, and even what color it is. What's the texture? And here I refer to Robin Bjork's STRIDE classification, where she describes the tissues as watery, fatty, putty, or woody. And I'm going to just elaborate on that a little bit. Watery tissue is found commonly in stage 1 of lymphedema, where it's soft and pitting and easy to reduce. And there's a negative stemmer sign, which I'll talk about in a minute. Fatty tissue is found in stages 1 to 3. What is the difference between healthy fat, lipedema subcutaneous adipose tissue, and lymphostatic fibrosis? That's a skill for hands to learn how to palpate the difference. And also we have visual cues for that. Does the tissue feel like putty? This is what we see often in stages 1 and 2, where it's soft. It will pit, but it takes a while for the pitting to occur. And there is early fibrosis and a positive stemmer sign. So this is a little bit beyond watery. It's becoming a little bit more of a solid now. And then woody. is hard tissue that does not pit, has extensive fibrosis and a positive stemmer sign. And this is often seen in lymphedema stages 2 and 3. So for more information, I refer you to Robin Bjork, who has a very nice article about this classification. There are also some tests that we can do to test the skin elasticity. And I have a little slide here that shows you visually what pitting is. You're basically depressing the tissue for a period of time, usually up to 15 to 30 seconds, and then waiting to see how long that pit takes to resolve. And that determines how severe the pitting is. Stemmer sign is the ability to pinch a skin fold from the top of the second finger or toe. And a stemmer sign can be positive because in this case, there's quite a bit of swelling, or it can also be positive because the tissues on the top of the digit are very hardened and they will not compress. Lastly, tissue extensibility is like doing a stemmer sign anywhere in the body. Can the tissue wrinkle up, especially if it's compared to the other side of the body or another part of the body? Not all parts of the body will wrinkle up the same, but if there is an impairment, this is a good thing to note. Because with fibrotic tissue and even swollen tissue, it's hard to form a little bunch of wrinkles. There are also testing devices such as calipers and so on that can be used in the clinic to be able to document the amount of skin elasticity and also document change. And one device that I have been using fairly recently in my clinic is ultrasound imaging. And I have a device that is capable of looking at the elasticity of the tissues through a function called elastography. And that uses colors to designate the stiffness or hardness of the tissues. So you can see near the top, and the top, by the way, is the skin. This is a little slice of tissue. So we're going down and looking at the swelling, which is pretty soft. It's liquid. You can see that in the blue coloration. And then you can see little fascia lines. And below that layer of fascia is actually a muscle, which is a lot firmer. And so you can see the red coloration. So this is just an interesting way of looking at fibrosis through ultrasound imaging. So when we look at all the different impacts of fibrosis, we can see that in addition to the swelling, we can have added pain. We can have more swelling. We can have a decrease in function, and it can affect mobility. It can certainly create a lot of tissue damage, and it is progressive, as is lymphedema. They kind of work together. It can negatively impact the quality of life, as well as the individual's ability to manage symptoms. So I want to introduce a key concept here that I'll be talking about a little bit more when we discuss treatment. And that concept is that fibrosis is an inflammatory process. We've known for a number of years that lymph stasis alone cannot account for the destructive tissue injury associated with lymphedema, that it's the inflammation that is driving the fibrotic process. And as Dr. Stanley Roxon mentioned very recently, inflammation and fibrosis are intertwined. And I know that he has been doing a lot of research looking specifically at anti-inflammatory medications for lymphedema. And I think there's hope that there may be something in the future that could be helpful on a pharmaceutical level to help with both lymphedema and fibrosis. But in the meantime, inflammation creates this vicious cycle. The inflammation over time produces fibrosis, which creates a deposition of adipose tissue, which in turn impairs lymphatic drainage, which creates inflammation and starts the cycle all over again. As you can see by the arrows, each component can influence every other component. And this is why I consider this such an important area. I could never treat lymphedema on its own. I have to be looking at fibrosis because fibrosis is so intertwined with the progression of lymphedema. And if I want to halt the progression, then fibrosis is the key to doing that. So, can any one approach treat all lymphedema, inflammation, and fibrosis? And I would have to say no. I think that it's important to have a generous toolbox with many, many tools because each person is an individual and different tools will work better for some people and not for others. So I am going to be sharing after our break a little bit from my toolbox so that you can have access to some tools that are helpful in treating lymphedema and fibrosis. Just before we break, I want to talk about the goals that I have in mind when I have a patient that has fibrosis, which is everybody in my caseload. So first off, you have to reduce swelling. It's critical to go through the CDT process to have a good reduction because it's very difficult to treat fibrosis when you have swelling. Although many of the treatments for fibrosis do help swelling, we want to get that layer off before we can get down to the hardened tissue. We want to compensate for damage to the lymphatic system and facilitate tissue remodeling and healing. We want to reduce the fibrosis formation and maturation and empower people with education and tools. Ultimately, we want to prevent progression of both the fibrosis and lymphedema. And I'm here to tell you that even long-standing chronic fibrosis can change. So with that, we're going to take a break and I will be coming back and discussing how we treat fibrosis.
Wonderful. Thank you, Karen. Some great information already, and I can't wait till we get to the part about treatment. If you have questions today for Karen, I'd invite you now at this time to start thinking of those and typing them into the chat. Karen, following her portion on treatment, will also address some questions and answers. And now I'm going to welcome one of our board members, Kim Radford. She is an experienced certified garment fitter in Winnipeg, and she's also LAM's treasurer. And she's going to explain some prizes that attendees could win today.
Thank you. Hi, everyone. So we will be doing a prize draw at the end of the conference. In order to win any of the prizes, you must be in attendance. So definitely stick around until the end. Our first prize, donated by Diamond Athletic Medical Supplies, will be 1 pair of best fit compression stockings or 1 compression arm sleeve and glove, measured and fit by a certified compression garment fitter. So remember, compression therapy plays an important role in the treatment of lymphedema. Compression therapy can help manage symptoms such as tired, achy legs, swelling, spider veins, varicose veins, skin changes, and leg ulcers. So definitely something we can all benefit from. Our second prize, also donated by Diamond Athletic Medical Supplies, will be a 1-year paid LAM membership. So your individual membership will give you a subscription to the Canadian Lymphedema Framework, Pathways magazine, an opportunity to participate as a LAM board member, as well as discounted registration at LAM events and symposiums. For the professional members, you'll get 5 additional copies of the pathways for patient distribution to help support your professional practice. Advertising in LAM's Swelling with Emotion newsletter, which will come out quarterly, as well as on LAM's website. We'll also have a feature listing and mapping location of your business or therapist location in the trained lymphedema therapists in Manitoba on LAM's website. So if you have already renewed your membership, we will definitely be reimbursing you your money. And then our third prize, which was donated by Elasticity, is a $25 Tim Hortons gift certificate. And it's just in time for Roll Up the Rim. We will be in touch with the winners next week to let them know how they can claim their prizes. We would love your feedback on this event. So after the event, we will be sending out an email with an evaluation attached. So please take time to fill out this evaluation. Very important for us with planning future events. If you submit the evaluation before March the 12th, you will be entered into a draw to win a Hillary Drucksmann necklace. So we will notify the winner by some social media. So now it is time for a 10-minute interactive break, which includes some movement and acknowledgement to our valued sponsors for making this event possible. Please join Amanda Sobey in some active movement to get the lymph fluid moving.
I got it this time, you guys. I got the mute button. Thank you so much for the introduction. As everybody knows, the lymphatic system is powered through your muscles. And I think being in the fitness career that I do have, a lot of people have this misconception of what fitness does look like. So together, I hope you're going to participate with me. I put a very simple and easy stretching routine that you can do from the comfort of your chair. And again, it just feels good to move. And part of my advocacy efforts is to encourage those to start moving. And I know with lymphedema and or lipedema or lipolymphedema or any sort of mobility issues, it's hard to move, but I guarantee you that we can do a simple stretching routine together. So please join in with me as I guide you through a very simple stretching routine. We're going to start by waking up our lymphatic system. So if you take your hands and let's just start waking up underneath the neck as we go in that backwards 7, very traditional MLD stroking method. We're going to do this 4 times up the jawline and back, just to wake up those lymph nodes. We're going to take one hand and we're going to go under the axillary region, again, going in that beautiful C curve to wake up those nodes, to push that fluid, vice versa on the other side. Oh, and I've got one arm that's disappearing with my blue screen here. So hopefully I don't fade away into the background. And then obviously finishing in that watershed area, again, dumping and flushing. Okay, so 3 and 2 and 1. One more time, up the neck and down. Here's 2, 3, 4, and then again, underneath the armpits, just waking it up. Again, I'm sure we don't do this every single day, but after we finish this, we're going to feel better. I guarantee it. And then finishing in the watershed area. Here you go, 2, 3, 4. Now let's get some therapy for our neck. Let's just flop the neck over and slowly let gravity rotate the neck 360 degrees around. Again, this is very simple. You may not have as much dexterity as some other people, which is totally fine. We are not moving very viciously. We're going very slowly as we try to work through those crinkles and those pops. If you have a stiff neck, sometimes a little bit of extra applied pressure feels really good. So just listen to your body and take it slow. Reverse the direction and go the opposite way. Again, very slowly as you rotate your head around your neck. Back up to center. Very easily now, we're going to take a shoulder check, look left, which is very important for our Manitoba drivers. You never know who's scooting past us in our crazy roads these days. Back to center, go over the opposite way. Again, you just want the head and the neck to rotate and play with one another, allowing for mobility. back to center. Take one ear and drop it to the shoulder, and take the opposite hand and reach down for the ground. Really intensify the stretch. And this one's a good one if you sit at your desk all day. So please do participate. This one you don't want to miss out. You can miss out on the rest of ones. This one you don't. Back up to center, switching over to the other side and reaching down to the ground. Again, that extra added reach really does help to loosen up those neck muscles. Coming back to center, taking the shoulders now and squeezing them into the ears. Squeeze and squeeze and squeeze and squeeze. And then we're going to roll those shoulders and dropping them into proper posture position. I'm sure we could all use this a little bit more in our life. Keep the head away from the neck and let those shoulders sit deep low. Don't crunch them up. One more time, squeeze them into those ears. Squeeze and squeeze and squeeze and squeeze. And then roll those shoulders back and down. I like to practice this because I slouch over too. So again, hold yourself nice and strong. We're going to do a big, beautiful rainbow stretch, as I've called it. We're going to take one hand over as we just stretch sideways. And again, get that side panel of the body. You can still continue with your hand. You can also encourage nice MLD stroking. Again, if you have a compromised lymph system, you can help push this towards your watershed area as you take this stretch. Exhale to release. Come on over up to the other side. Repeating again, taking that stretch, stretching out the side back panel, and again, stroking some MLD. Perfect. We are now going to start to march on the spot. So again, just underneath your desk, you can lift and start to march those legs. Again, whether you have lymphedema or not, everybody does benefit from moving. And I got to tell you, I've started to wake up just by moving my body. So I really hope that you're participating. And we're going to take this into a can-can. We're going to take the heels and we're going to heel tap outwards. So I'm kind of like kicking in front of me. Again, that gentle bounce, that gentle tap is going to help to stimulate that lymph that's down at the feet. And we're going to bring it back to center. Pop in some calf raises. Here we go. 1 and 2, 3. I know you can't see me, but I'm doing it. 4, 5. Very quickly now, take your toe down, heel up, and just oscillate the heels. Rotate those ankles. Again, this feels really good. If you get lots of swelling in those ankles like I do, it gets uncomfortable. Reverse that direction. We're almost there, you guys. You did it. Here we go. Other side, switch it over again, oscillate the heel around, making little baby circles, reverse that direction. And just like that, you've got a good stretch in. Right now, thank you so much for participating with me, but we are going to share our screen to thank our gold sponsor, Juzo, for this event. And I believe Adrian is going to share the commercial, and I look forward to hearing the rest of Karen's presentation. So stay tuned.
All right, so I'll hand it over to Karen again to continue on with the rest of her presentation.
Thank you so much, Adrienne. All right, so somehow I'm going to need to share my screen again, and there we go. So let's move on and talk a little bit about fibrosis treatment. I've been talking about fibrosis for many years, and I have just been gathering tools left and right from my toolbox on how to treat fibrosis. And I've identified them in these areas: anti-inflammatory approaches, manual therapy, modalities, anti-fibrotic compression garments, and pneumatic compression. There are so many tools out there. And like I said, I can talk for days on this. So we will be focusing today about anti-inflammatory approaches and anti-fibrotic compression garments, although I will give you a little overview of some of the other areas. So let's talk about inflammatory load. And many of you, this is going to be a new concept that you have never really equated inflammation with lymphedema or fibrosis. And this fishbowl represents too many fish. And that means that the risk factors for inflammation are overwhelming to the point where the fishbowl is overflowing and there's fluid everywhere. So our goal is to decrease the risk factors. Now, some of them we can do something about, some of them we can't. But if it's possible to take care of the ones that we can, then it helps to reduce the overall effects of inflammation. So there's a number of different approaches that can be used when we look at inflammation in lymphedema, lipedema, and fibrosis. And I always am educating my patients about risk reduction for lymphedema, but also for inflammation. There's different diet, drugs, and supplements that can be helpful with inflammation, as can counseling, complementary and alternative medicine, and CDT lymphedema treatment is phenomenal for inflammation. So we're going to touch on a few of these approaches first. In terms of risk reduction, we want to lower the inflammatory load. And the number one way to do that is to lower body mass. Also providing decongestion and compression and different modalities, as well as having a therapeutic environment, all help with inflammation. Many patients have inflammation that starts from the gut. And we're hearing more and more these days about the lymphatics in the digestive system and how we have so many different diseases and factors that can influence gastric inflammation. Primary lymphedema has a known gluten intolerance and GI dysfunction for certain types. And the platelet factor 4, which has been identified in lymphedema and lipedema, is also present in Crohn's disease. I do a certain amount of education, but often I find that I need to rely on experts. So cultivating relationships with people who can do blood and skin tests and talk about different types of diet, eliminating possible allergens. I know that Leslyn Keith has spoken to your organization about the ketogenic way of eating, and the Lymphedema and Lipedema Nutrition Guide. All of these offer approaches to help lower the inflammatory load on the gut. What I tell my patients is the gut is so important that if mama ain't happy, nobody's happy. So let's talk for a minute about medications and how side effects of many common medications can create inflammation. So here you can see that many common drugs cause fluid retention, which includes antidepressants, diabetic medication, steroids, immunosuppressants, And I don't suggest that people go off these medications, but instead talk to their doctor and see, is there any other way to get the effect without this particular medication? Or is it possible to cut down a little bit? And the list goes on. Chemotherapy, particularly the taxoid drugs, have known effects on swelling, pain, and paresthesia. Calcium channel blockers, commonly used to treat heart disease, and even pain medication. The one that I think has some of the most profound effects on my caseload are the anticonvulsant, antineuralgic class of medications, which include Neurontin and gabapentin. And sometimes people get a prescription that is given, and years later, they're still taking it, and they may not need it. So this is an opportunity to educate your patients and to go through the medication list and to see what are these drugs doing that might be influencing swelling, and is there another way? Complementary and alternative medicine can also impact inflammation. Using yoga and meditation, massage therapy, acupuncture, which has, by the way, been proven safe for lymphedema, aromatherapy, and energy healing. All of these are areas that are evidence-based to help with stress and inflammation. And as I mentioned, CDT, I pulled a bunch of recent studies that are showing how diaphragmatic breathing, which I teach to every one of my patients, exercise, MLD, and compression are all very, very helpful for inflammatory symptoms and influencing the autonomic nervous system. I'm going to just touch on some anti-fibrotic manual techniques that I use in my practice, just to give you an idea of what's out there. And if you think that you could benefit from this, find a therapist that is knowledgeable. And if you're a practitioner, I encourage you to get additional training in some of these areas because it can make a huge difference. So traction assisted is basically just using different types of anti-traction, anti-skid materials such as Dysum or gloves that have a sticky surface to help to stretch tissues. There are massage tools that can work as MLD alternatives that can do a deeper anti-fibrotic manual lymphatic drainage. Not every school teaches that when you have a patient who has fibrosis, MLD might need to be a little more aggressive and not painful, but just a little firmer to be able to influence those harder tissues. Myofascial release is a very specific and useful type of manual therapy that works with adhesions and scar tissue and fibrosis all over the body. Some of you might be familiar with Quadrivas. This is a very specialized technique that was developed for use with lipedema patients. And Dr. Karen Herbst has studied this, and it is very, very effective in working with subcutaneous adipose tissue fibrosis as well as nodules. And there's a few studies out there on this that have shown how helpful it is. Using range of motion, whether it's active, active assisted, or passive, with and without manual release, can be very, very helpful for large areas of fibrosis, as well as small scars. And neural tension techniques are a very good technique to know about because fibrosis can trap nerves and can create a fair amount of pain. So being able to release the neural tension in the body can be very, very helpful in reducing pain. In addition to manual techniques, there are many modalities out there that can be very, very useful. Various types of positive pressure, negative pressure, light therapy, and I have a low-level laser that I use in my clinic that is FDA approved for the treatment specifically of lymphedema. Because with both light therapy and thermal modalities and ultrasound, we need to be a little mindful that if anything creates heat, that could be contraindicated because it could exacerbate lymphedema. So being able to use these modalities in ways that don't worsen the lymphedema, but can help with the fibrosis, it's a balance. Microcurrent is another modality that is evidence-based for treating scar tissue. And many of my patients love using vibration, whether it's a handheld vibrator or a whole body vibration plate. It can be a stress reliever, it can help with muscle tension, and can also help to impact fibrosis. Dry needling is a very specific technique that is practiced by some physical therapists and by acupuncturists, where needles are inserted directly in the scar. I have personal experience with this, as well as a lot of experience with many of clients that I have referred to acupuncturists for this technique, because it works in a way that all of these other techniques do not, because it's working, as Chinese medicine believes, in the meridian system and the qi flowing in the body that can be disrupted through fibrosis. Silicone scar gel is an evidence-based method of reducing the stiffness of topical scars. It's very good for keloid scars. It is readily available and needs to be used for a couple of months to see a full effect. It can be used on healing scars where the tissues are closed and there's no longer drainage. It can also be used on old scars, and it does have a wonderful impact on the stiffness and hardness and ropiness of scars. Likewise, I use elastic taping and even paper tape over scars. I find that using paper tape over drained scars is particularly helpful, and there's some specific protocols to use with that, and definitely evidence to back both of these techniques. So now we're going to move on to anti-fibrotic compression garments. And with lymphedema, we need to be considering compression anyway. So why not consider compression that also helps with fibrosis? So there's two main types. There's elastic and quilted. And in both cases, there's a texture to the garments, either woven into the fabric itself, or in the case of quilted garments, it is a texture inside that creates this micro massage to the tissues that helps with circulation, it helps with lymph drainage, but also helps to create a gentle massage to harden tissues. I have had patients who have had tissues that have started out feeling like stone, that have softened like butter. And some of it is due to the swelling that's trapped in there being evacuated. And some of it is actually due to the mechanical properties of these garments helping the fibrotic tissue. So we have low profile garments as well as bulky garments. And we'll talk about both of those. And the effects of these garments increase when they are used during exercise, when there's a greatest amount of bulk, a greatest amount of class or compression, and then we'll talk very briefly at the end about using external pressure and how useful that can be. So first, elastic compression has its advantages because it's low profile, it allows a lot of mobility and function. Depending on the stage of lymphedema, there are different types of elastic compression that are appropriate. I love using textured circular knit garments for stage 0 and 1, and sometimes even early stage 2. I also can use them as liners for other types of garments. The texture really compensates for the lower compression. And I personally wear textured tights when I fly because I've tried all types of compression out there. And this is the most comfortable to wear, especially if you're going to be traveling for extended hours. Some specific names of these elastic compressions are edema wear or anti-cellulite garments such as Solidea, Bioflect, and Cisalis, which are all available on the internet. However, for people who have a great deal of swelling, these may not provide adequate containment on their own. And if they are used, need to have a wrap or bandage or something over them to be able to create more compression, because the textured circular knit are wimpy when it comes to controlling profound swelling. So in those cases, we look at custom flat knit. And for the upper extremity, it comes in classes 1 through 3, and lower extremity, it comes in classes 1 through 4. These are some pictorial examples. On the left, you see the textured circular knit that is not medical grade. On the right, you see the custom flat knit, which is medical grade. So in terms of quilted compression, this is bigger guns. I love quilted compression, and there's different ways of doing it. The lower profile types are Comprex 2, I'll show you a picture in a minute, as well as channeled foam and orange foam. But the bulkier, the better for fibrosis and for swelling. And that's where we're looking at chip foam pads or garments. And you can even make chip bags out of little foam scraps that can help with fibrotic spots. Cherry pit pads or garments are very, very aggressive. So a lot of caution needs to be used with them. And waffle foam is something I mentioned because some people use it. There are compression garments made from it, but I discourage the use because it flattens fairly easily and the anti-fibrotic effects are not sustained. To increase the anti-fibrotic effects of quilted compression, it can be bandaged over. You can use Velcro wraps over it. Some come with elastic compression that snugs it in a bit, or you can also use a pump. So these are some examples, and I want to acknowledge your sponsors for providing me with pictures of arm sleeve, leg sleeve, and a custom quilted arm torso combo. This is just a taste of all the different types of quilted garments that are available out there. These are typically worn at nighttime, and some people, if I have a patient that is in reduction boot camp, we may make this part of the CDT if they have a great amount of fibrosis, and they'll wear it day and night under bandages. This is a phenomenal treatment if you're not aware of it and you have fibrosis or significant lymphedema. This is a very, very effective treatment. For smaller areas, there are pads that can be used underneath the bra, underneath clothing, underneath bandages, or even an elastic compression sleeve. So on the left, we see a couple of examples of pads that are quilted with chip foam inside. On the right are a couple of pads that have cherry pits in them. And I don't know if any of you are familiar with this or use these. This is a type of anti-fibrotic compression that I devised, 13 years ago, and did a little IRB study and presented this at the International Congress in Australia in 2009, and then published it in the British Journal of Lymphedema in 2011. So that study is available online. And I am going to be linking that to my website when I get back. I've got a lot to do, but cherry pits are amazing in terms of their anti-fibrotic effect. And I encourage you to check it out if you haven't tried it before. This is an example of channeled foam. So it provides a negative space that allows for lymph drainage, but it also it's a variable compression. So it's just a step under chipped foam where you can have different surfaces with different amounts of pressure that can create variable decongestive as well as anti-fibrotic effects as the individual is moving. This is Comprex 2, which I have paired with gray foam. And this is something that can cover a small area, or it can cover a large area. And it can be washed and is nicely cut to different shapes and sizes. So this is kind of like making your own pad, custom made, and is very, very helpful underneath other types of compression. To increase the anti-fibrotic effects of any of these garments that I've mentioned, the left two pictures are of some different wraps that can be used. The one on the left is an arm wrap. The one in the middle is for the lower leg. And wraps can be used, they can be customized. There is such a variety of types of wraps that are out there. And what's lovely about wraps is that unlike static compression garments, wraps can be used dynamically so that after CDT and after a person has gone through the bandaging, they can get further reduction by snugging in the Velcro and making it different sizes. Likewise, if there's an exacerbation of swelling, the straps can be loosened to accommodate that. And then what's nice about these is that as you're walking around or moving, going throughout the day, the wraps can then be tightened because the muscle effect creates a pumping action. And unlike bandages, with wraps, you can just cinch the Velcro a little tighter after maybe an hour or so, and just keep doing that all day to create a good reduction. So this is an example of how we can use these wraps over the chip foam garments to create a more compressive effect for both decongestion as well as fibrosis. And on the right is an example of a pump garment that is used for the upper body. And likewise, you can put quilted compression underneath this pump garment. And I tell people it's like having a double massage because you have the variable texture of the chip foam, and then you have the more aggressive pressure of the pump that is on top of that. And there are varieties of different pump appliances that can address all different parts of the body. So I love using pneumatic compression concurrent with these anti-fibrotic compression garments to help with very powerful decongestion as well as anti-fibrotic treatment. Pump treatment is called intermittent pneumatic compression. And as well as compressing, it decongests swelling. It increases circulation. It promotes healing. And the higher pressures are often used to soften and remodel the fibrotic hardened tissues. I want to give a little caveat here is that when I'm titrating the pressure for pneumatic compression, I'm very mindful that I don't want my patients to have any type of pain or discomfort whatsoever. I tell my patients this should not be torture. This should be therapeutic. And so it's a tricky balance to make sure that the patient is getting enough compression to do the job, to impact the swelling as well as the fibrosis without causing discomfort. So the net gain is that softer tissues create less obstruction to lymphatic circulation, and there's increased spontaneous circulation. I'm going to say that again, because this pretty much sums up everything that I've been talking about today. If we can soften the hardened tissues, there will be less obstruction to lymphatic circulation, which will give increased spontaneous circulation. And the gain that we achieve is that we can move the lymph better using our own bodies and halt the progression of fibrosis. So I was right on the money as far as the first half. I'm a little tiny bit early for the second part, but I think that what this will do is give us a few more minutes to be able to have questions and answers. And I hope that you do have questions for me, because I love talking about lymphedema treatment and in particular fibrosis treatment. So with that, I want to thank you so much for your attention. I'm going to stop sharing my slides and invite your questions. So I'm going to just open my chat, and I'm going to start from the bottom here. And there's a question that asks, do you have tips for genital fibrosis? Oh, yes, I do. And one of the pictures, I don't know if you remember back to the slide where I discussed the radiation-induced fibrosis, but the picture on the left was actually a scrotum. And it was a gentleman who had radiation therapy 20 years ago, and his scrotum was so hard. And what we did was, after doing a good CDT program, and in the process of that, we used chip foam around his scrotum, and he had to have quite a number of them because of hygiene. He also had a suprapubic catheter, so luckily he didn't have problems with leakage. But we advanced to the cherry pits, and that was very, very helpful. And then I was able to get him a pneumatic compression pantsuit. I also did quite a bit of targeted treatment in the clinic using the low-level laser. And I found that usually 6 to 8 treatments is a good amount for affecting fibrosis. Sometimes we have to use more if it's profound. But he ended up having a lovely reduction in both of his legs and his genital area. We were able to significantly soften the genital area, and he was a much happier person. So thank you so much for that question. I'm going to go backwards here, and please keep asking questions, because I want to answer all of them. So let's see. I can't answer this one, but I'm hoping that maybe, Adrian, you could address this. Is lymphedema treatment and especially therapy covered by Manitoba Health? And what garments are covered? And if not, why? I know that in the US, insurances can widely vary. And I've also, I've spoken a couple of times in Saskatchewan, and they have specific criteria. So I am aware that each province has their own regulations. So could you possibly address that?
Yes, thank you. Yeah, so Manitoba Health doesn't cover the cost of manual lymphatic drainage for lymphedema. They don't cover compression garments. So really it's not recognized condition for needing treatment at this point. It's something that LAM works hard and continues to strive for and press the government to treat or to cover, sorry. And so what ends up happening is that people have to rely on their private insurance companies for treatment. And unfortunately, we do see, at least in the hospital system and the public system, that some individuals go untreated because they're not able to afford the the services that they need. So it really, there's not always that equitable access to resources, unfortunately.
But I would say that even if a person has to pay out of pocket, that at least having some visits for education and to learn how to do, because there's components of CDT that can be done at home. And it's certainly, if you weigh the cost of compression versus going in and getting bandaged, it's possible to do a home CDT program under the guidance of a lymphedema therapist with the correct equipment. And I think that I would encourage you to be active politically to change this, because it is such a need. And sometimes it takes a while to get the effort together, but it does happen. It is possible. And we have a huge effort going on in the United States right now, because Medicare, which is a major insurance for many of our older patients, does not recognize or cover compression garments at all. And so we've been fighting for years, but it's something that we continue to do, because really, insurance needs to recognize that it's so much more expensive to pay for a hospitalization for an infection because someone has gone untreated or inadequately treated for lymphedema. So thank you, Adrienne, for mentioning that. And I'm going to go on to more questions, one of which is, do you buy or make the cherry pit pads? And I would say both. I actually have made bean bags out of beads that work just lovely. And so beads are just as aggressive as cherry pit pads. And the reason why we chose cherry pits is because we were looking for a medium that would not fall apart in the wash. So beads certainly do the same thing. So that's something that you can definitely do. And Amanda asks, have you learned or found of any successful supplements or medication to manage fibrosis? And wow, Amanda, that is such a great question. I have a whole lecture about nutrition and lymphedema and fibrosis. And there are a number of different supplements out there, but rather than just sort of throw all the names out, I think that it's something that needs to be done under the guidance of a medical professional, because some of them can actually have side effects and be harmful if they're used inappropriately. So in general, I would say that if you can find a good person that is a resource to work with, that's really the best, because everyone is different. We all have different body chemistries and we need different supplements. So a qualified nutritionist or other specialized professional would be the best to advise on the specifics. But in answer to your question, yes, there are many, many things out there. Another question is, what is your specific protocol with the use of the laser? So first off, let me just say that all lasers are not created equal. And there are lasers that are red light that produce heat. So the first thing is that I use an instrument that is non-thermal. So that's very, very important. And then the instrument that I use is a class 1, so it is eye safe. So it really has the least amount of possible risk to use with patients. I generally use it about 45 seconds to a minute at each site. And the beam will extend out a couple centimeters and it will go down at least a couple of centimeters. And so I create a grid on the body. I find that I am most successful using laser treatment for focal areas. So a scar or an irradiated area or a seroma or cording. It's great for cording, but I don't find it to be as helpful for lymphostatic fibrosis because it can cover such a large area unless we're talking about a specific pocket. So if I'm looking at giving the patient the best bang for their buck in terms of treatment, I'll use my laser for maybe 5 or 10 minutes, concurrent with other techniques such as manual therapy. And then I'll focus on other things that can help the fibrosis as well. So do you recommend shockwave therapy? If so, do you know how it works? I am familiar with the concept of shockwave therapy, and I've read a few studies on it, but I don't have actual access to the equipment. So that's not something that I think that I can address in this talk, but thank you so much for the question. What lymphedema research studies do you feel are most needed? Oh my goodness, that is such a huge question. I think that there's a lot that's being done in lymphedema that has been done because we think it works, and then we're just now getting research that's proving that maybe it doesn't work as well as we think. So I think all aspects of lymphedema. An example of this is the work that's coming from Australia with Dr. Haru Swami and his group, where they are now showing that when we're doing manual lymphatic drainage, the groups of lymph nodes that take the fluid from an infected quadrant are the ones in that quadrant. So in other words, for someone with breast cancer, even if she has had surgery and radiation and has lymph nodes missing from a particular armpit, that armpit is the major drainage area for most of the lymphatic fluid in the arm and the trunk. And then the next most are the cervical lymph nodes and then the parasternal lymph nodes. And they're finding that very, very, very little fluid gets taken up by the opposite side lymph nodes or by the lymph nodes that are neighboring in the other direction, like say in the groin. And they've proved this using ICG imaging. So I think that doing imaging studies that are looking at the treatments we do and proving that they're effective is very, very important. I think that one area where a lot of research is needed, believe it or not, is in MLD, because there's not a lot of hard research that proves the efficacy. And we know it works. Those of us who do it, those of us who have received it, we know it works. But I think that that is a huge area where doing ultrasound imaging, doing ICG imaging, MRI imaging, where we can look in real time at what's happening to the body and show the uptake of lymph with the stimulation of manual lymphatic drainage. I think that is a critical area for research. So next question is, have you used negative pressure in treating fibrosis? Absolutely. And how much efficient have you found it? Highly. Does it have the same effect with different stages of fibrosis, or can you recommend it with certain stages? So I have used both the different types of machines that are out there that produce a negative pressure. They're like a little vacuum suction. And then I also use cupping. But I think it's very important to have training in the use of negative pressure because it can cause bruising, it can cause broken blood vessels. And yes, I think it's very effective for fibrosis. So effective that I will even teach certain patients that I think are responsible enough and can follow directions so they don't hurt themselves. But it also does have such a huge potential for harm. It should be used very carefully, and there needs to be instruction in how it's used, both for the therapist and for the patient, so that they understand all the different ways to use and not use it. I love negative pressure. I think it's very fast track. And I think that lifting the tissues, it affects fibrosis in a different way than positive pressure, such as massage or the use of an instrument. And I use everything. I'll do some light therapy. I'll do a little positive pressure. I'll use some negative pressure. And I see permanent changes by the end of the session. where the patient is able to keep those gains and keep progressing. And I'm going to give an example because I don't think I've emphasized this enough. Even with long-standing fibrosis, you can make changes. And my case example is a patient who had a lumpectomy 30 years ago. And she came in with a very swollen left breast and a lot of pain. And she was wearing a compression sleeve. She knew a little bit about manual lymphatic drainage, but she had this hard fibrosis at the lateral side of her breast and in her armpit where they had taken lymph nodes. So we worked with the light therapy. We did some positive and negative pressure. I certainly was working with the swelling, and we were able to get her down 2 cup sizes. So she was able to wear a prosthetic in her bra to balance that breast out and actually act as a compression garment. I'm a big fan of prosthetics for people with mastectomies and lumpectomies because I think that they can be really useful to help compress those tissues. So she was a happy camper because her pain went down, her swelling went down, and I think that even though it had been 30 years since her initial surgery, we were able to make big changes. So I feel like there's always hope. More questions? Let's see. Oh my goodness, we are out of questions. We still have 3 minutes. Type fast. I'll keep talking because I could talk all day. I could talk all week about this. This is such an important area because beyond treating the swelling, being aware that leaving swelling untreated leaves people vulnerable to development of this fibrosis. I mean, you should show my talk to your legislators and tell them that this is what's happening because we don't have health care for lymphedema. This is what can happen, and it's so much more debilitating. Okay, how long are your treatment sessions with each patient? It varies. I work at a hospital-based outpatient clinic in California, and I am lucky enough to do 90-minute sessions with my patients. And the reason I do longer sessions is because a lot of my patients can't come in as frequently. And so we make that time count. We do a lot of education. It gives me a chance to really do a nice, well-rounded treatment. I also do telehealth, and those sessions are usually about an hour. So it can really vary depending on the situation and what the patient needs. Okay, no more questions? 1 more minute. What can I tell you in a minute?
Sorry, Karen Dobbin has asked how long are, oh, no, sorry, Diane wants to know, is acupuncture safe for lymphedema limbs?
Oh, yes. So there are actually some studies. Thank you for that question. There are some studies that have shown that acupuncture does not create infection. And a lot of acupuncturists can really judge whether it's appropriate to insert needles in the areas that are affected by lymphedema. And believe it or not, you can actually treat a meridian in a different part of the body and still affect a leg. So you don't even have to put needles on the affected leg. I would say if a person is prone towards lymphorrhea, if they have really fragile skin, if they have a history of infections, I tell my patients to consider all of these risk factors and take a shower before going into the acupuncture session so that the skin is clean. And that way, if there is a little tiny bit of a wound, it will usually epithelialize or heal over within 24 hours. And for those that maybe bleed a little bit, dab a little bit of antibiotic ointment on it just to be safe. But I think that acupuncture is a wonderful treatment that has a myriad of autonomic benefits as well as direct benefits for lymphedema and fibrosis. So I think that it's something to definitely consider. Okay, I think we've come to the end of our Q&A, and I'm going to mute myself and turn it back over to Adrienne.
Wonderful. Thank you, Karen. I think one of the things I took from your talk especially is just to keep talking about lymphedema, to keep being vigilant, and also to educate. Because if we can't do anything, we can educate and create increased awareness and get more people talking. So thank you for presenting, Karen. And we also want to thank again our sponsors for making this event possible, and also for all of our attendees for coming today. So thank you all. And we've hoped that you've gained some valuable information as well. We want to invite you, tomorrow, March 6th, is World Lymphedema Day. And we want to invite you to do a walk with us. It's the second annual Light Up the Legislative Building in recognition for Lymphedema Awareness Day. So I want to thank Vice President Amanda Sobey for initiating this event last year. In closing, just want to thank you all for being with us today. And I want to thank the Lymphedema Association of Manitoba's dedicated and talented board. It was a lot of work putting this awareness event on, and the one tomorrow as well. And we're just really excited to celebrate and to come together to create more awareness. So thank you for attending with us, and all of our guest speakers and sponsors today for this event. And we will say goodbye, and we'll be in touch with all the prize winners regarding how to collect your prizes. So thank you again, and have a great rest of the weekend.